All right, thank you so much for staying with the Monday Report. This is where the town hall session begins. We'd like to hear from you. Use the hashtag Monday Report at Trevor Mbija at Citizen TV Kenya. We're talking about tracing the COVID-19 billions in the counties specifically. The Control of Budget report shows that 13.1 billion shillings was available to the counties as at March when the first COVID-19 case was reported, but only 3.4 billion shillings was accounted for. Where did the rest go? That is what the Senate Ad Hoc Committee is currently tracing in the counties. The chairperson of that ad hoc committee is here with us tonight, Senator Sylvia Kasanga. Thank you so much for making time. And Governor Alfred Mutua, the governor from Machakos County, is also with us. He'll tell us where the money is going in the counties. Senator, you have been touring the counties the last week or so. What have you found out so far?
Trevor, so much. Thank you for inviting me and thank you for following up. We did have this conversation, I think, a couple of days ago when we had just landed in Mombasa County. Our investigation started in the Coast Province. Actually, no, we started in Isiolo. Isiolo was our first county to visit, and then Meru. Then the speaker put a cap on physical meetings, so we couldn't travel after that. But now, after a lot of persuasion, he agreed that now we can continue with our investigation, which took us to the counties of the coastal region. And we were able to get reports from frontline workers. That was where we started first. We always like to hear from the frontline workers, and we're able to hear their experiences from Mombasa County, Kilifi, Kwale, Taita Taveta. We're able to get a report on their challenges and where we can intervene, actually. Then we were able then to visit each of the three counties. We only manage the three counties, unfortunately, and we wish we could do a lot more, but the budgets right now in Parliament are very tight. But we are still trying to push Parliament to enable us to do a lot more investigation. I must say, Trevor, when you hit the ground, it's very interesting how the information then comes.
Yeah.
Things are different, definitely, on the ground. And you know, we had very good reports. We have very good reports which we want to share, as well as a few negatives here and there where I think the governors and others can help. In the first instance, in the Mombasa County where we started, we were received very, very, very well. And we had the report from the frontline workers where they had told us some of their challenges, including not getting their remittances being done, like NHIF, and NSSF and all the others, and that was also affecting their ability to treat themselves in the case when they get sick. Some of the counties, it was reported that they don't have adequate PPEs. And the biggest issue actually that came out with the frontline workers in the coastal region is the fact that there's not enough, there's not enough incentives being given by the county governments themselves, considering they're putting their lives right at the front. So that was an issue which we tackled with each of the governors that we met. And, you know, we would like to report that back here again, even before I go to the actual monies.
Yeah.
Allow me, Trevor, just to talk about a few positives that we did see down at the counties when it came to this COVID approach to the counties, starting with Mombasa County. Mombasa County, we saw a cooperation of a county government and its stakeholders, private sector. They came together in such a strong way. In fact, it was so impressive because even by the time the national government, Ministry of Health, sent their money to help, Mombasa County stakeholders had already come together and they had already contributed towards COVID. And what the county government of Mombasa did is that they stationed the COVID health response with the Coast General Hospital. They're actually the ones who handled the entire strategy, which was quite impressive. So it means that issues of accountability then came out very clearly when we started tackling issues of money. And although Mombasa County had not brought their report to the Controller of Budget at the time the report reached us, actually they had all their papers ready, even for us, because they had me speak on the news, Trevor, the day we spoke. So by the time we arrived at the offices, they were actually ready. And it turns out that they had submitted their paperwork to the Controller of Budget at the county. So for some reason, somehow it didn't reach us in Senate, but we were able to receive all the documentation and they were able to explain to us what they did with the donations that they received.
Yeah, but Kasanga, that sounds rather convenient for me, because at the time when the Control of Budgets was filing this report, I'm looking at Mombasa here, and they got 177.8 million shillings. They did not account for a single coin at the time this report was being filed. So how then can they give you the report while you're there? Why did they give it to the Control of Budgets in the first place?
They say they actually submitted it to the Control of Budget at the county level. So why it...
Senator? Okay, we seem to be having a bit of a challenge.
Did accept them?
Yes.
Did accept them, because if they had indeed submitted them...
Yes, go ahead,
Sorry,
Senator.
am I still...
Yes, we're with you.
Sorry. So we did accept them. Plus, they also did take us through their mathematics at the Coast General Hospital. They were able to explain what they did with their donations. And actually, the money that came from Ministry of Health, they hadn't even started using it. In fact, that money, they had now earmarked it and put it as budget for expansion of Coast General Hospital facility to other out centers, which was quite commendable in our opinion. And one thing we did actually really praise the county government of Mombasa is their prudent use of funds, because they went to, for example, the Technical University of Mombasa, and they came up with an agreement for the use of one of their facilities as a COVID isolation center, as opposed to, going to construct and all that. Because the students are already out at home, they use that facility as their main isolation center in Mombasa.
So, Senator, you're saying now that you're satisfied with how Mombasa explained their expenditure, in as much as the Control of Budgets did not receive their expenditure from them. And by the way, when we spoke last on Daybreak, you told me that they were one of the counties that did not file a single coin. Why the change of tune now?
If you remember, I did say for us, we had flagged Mombasa County and we wanted an explanation from them. And we got the explanation. And it's okay to receive an explanation, accept it. And we received it and we accepted it. And even our interactions with Coast General Hospital, we were very convinced. We were actually very happy with their level of response, to be sincere. And so what we said is that...
Are you satisfied then with the Control of Budget's special committee report that they gave you? Because in that budget, the Control of Budget says that 13 billion was available to counties, only 3.4 billion shillings was accounted for.
No. This, Trevor, this has to be county by county basis. So if you just let me finish with Mombasa, because Mombasa, we had flagged it for that reason, and they were able to explain themselves. Over and above that, they were able to present the budget of what they intend to do with the money, which we were convinced, because Coast General Hospital actually is the one that was giving us that presentation, Trevor. Now, when we go to Kilifi County had a very low absorption rate of the monies that came from Ministry of Health. Their explanation for that low absorption was the fact that the money came just at the close of the financial year. So they were not really able to utilize it, but they were able to present a budget on how they intend to utilize it. So now what we said after that is now we wait for the Auditor General's report to show us how exactly each coin has been utilized. So that's how the two reports will have to work concurrently when the others come. So some of the issues that we were now flagging down at that point in time, Trevor, because you have to understand, to do an audit in a day in a county is very difficult. So we have to rely on these reports. But then again, we have to take some of the frontline workers' issues that now come out and our quick inspection of facilities to tell us, are we satisfied? Are we seeing some sense of truth in some of these reports that we are receiving? Now, in the county government of Kilifi, unfortunately, the governor was not available to meet us, so we were not able to meet with his finance team. We only met with the health team, and they were able to give us a breakdown of the things that they have done. Something interesting came out of our sitting in in Kilifi. We had a WHO, a World Health Organization official who is based in that region, and he did tell us that some of the donations that have been reported to have been delivered by KEMSA had not quite arrived on the ground, and yet the report reaching WHO from KEMSA was that those items had reached Kilifi County, for instance. So again, we flag that issue as something which we will need to inquire a little bit more when we come back to to Nairobi and we are meeting with KEMSA officials, we will want to understand some of these donor items that are supposed to have reached Kilifi that were donated by WHO. Why didn't they reach? This is something which we now discovered right there on the ground from a WHO official. So some of these are the things that we would pick up as we go, in as much as we might not be able to do a full audit.
Yeah.
We are able to say, okay, fine. So the controller of budget report, as per what was reported for Kilifi, is in a sense okay. But now we wait for the Auditor General's report to show us exactly how has each coin then been utilized. Okay. But when it comes to the protocol that was sent from Ministry of Health, that this is what each county is supposed to achieve, and they have sent that support in terms of money, actually all the 3 counties of Mombasa, of the coast region that we visited, actually, they did do their part. And in fact, you find now the unfortunate things that you will find are such that Kilifi has 7 ICU beds, which they have gone ahead and procured, but they don't have the personnel to run those ICU beds. Those are now the challenges that we should be talking about, because the capacity building that is required in our counties is clearly wanting.
Okay.
And you find the county...
Yeah.
Sorry.
Senator, I'll come back to you to break down the counties, and I find it perplexing that you say they did their part, because I can see here from the Control of Budgets report, Mombasa did not file anything. I see here Kilifi only used 55%, and then Kwale here only used 20%. But I'll come back to that in just a bit. Let me bring in Governor Mutua on this. Mutua, Governor, you see, your county of Machakos received, I'm seeing here, 395 million, but you only used 223 million, which is 56%. Where did the rest go?
Well, let me first start by saying hello and Mambo ni fresh, and saying congratulations, our Senator Kasanga. You have actually spoken about what we've been speaking about as governors, that there seems to be a lot of fiction when it comes to figures being presented about counties by national agencies like the Auditor General and also by the Control of Budget. Because what they say is not the reality. You hear about the things have been delivered, they're not there. You hear that monies have been transferred, they have not been transferred. When you go to the ground, things are very different. So there is always seem to be something trying to accuse counties of misappropriation or trying to accuse counties that they have not received money. And I want to thank the Senator, because she says she went there on a fact-finding tour and she's telling it as it is. She's saying that these are the documents, but this is the reality on the ground. Now, when it comes to Machakos, we have been given 285 million shillings. That's the amount of money that we know. We are given 188 million plus another 97 million to pay staff, out of which we have absorbed 98%. We only have about 5 million shillings left in the bank account that has not yet been allocated. So we do not understand the figures ourselves. We are a bit confused. We are wondering, where is this money that we say that has been given to us? We wish we could get that money as Machakos. So there seems to be a bit of fiction when it comes to the monies they are saying that they have transferred to us for COVID, because we got a letter. I got a letter from an AIE for 188 million. We also got another letter with 97 million. So where is the rest of the money they're talking about that came to Machakos? It is total fiction. And I don't know whether this is a technique to direct us away from the scandals that are happening in Afya House and others. But this idea of all the time blaming counties for this and that, with documentation that are aired on television, that are splashed on the front page of papers, is not proper. It is a culture of unfairness in this country that needs to change. If money is lost, let us be truthful about it. But let us not just go and give reckless accusations that have no basis at all.
So, Governor, you're disputing these figures by the Control of Budgets, because I'm seeing here it was 395 million. You say you got 288 million. But what did you file to the Control of Budgets?
We filed everything as we receive it. When I look at the figures that I have here in front of me, we have 280 million total, 285 million total, which we received in 2 blocks. One was the 188,521 million. The other one was 97 million. My own government also allocated an extra 100 million. In the last financial year, we said we'll allocate 100 million for COVID expenses, which was set aside for COVID. initially. But when we got the money from the national government, because that money had been taken from other core elements of government, we had taken that money from some salaries, we had taken that money from other projects. We now, when we got the 188 million, it freed that amount of money that we had received. We had actually used some of that money to start with to pay health workers. And so we were able to recover that money. So the only amount of money that we got from the national government for COVID is 285 million shillings.
Okay. Let me bring it back to Senator Kasanga here. Kasanga, you know, members of parliament, both the Senate and the National Assembly, have said that the COVID-19 investigations have been politicized. Are you playing politics, Senator?
Trevor, you know me, I don't do politics. I just say it as it is. And also, let me just make it clear, just so that I know Governor Mutua has thanked us for the work we are doing, but let me be clear. The Controller of Budget, the 3 counties that we have visited, each county confirmed the money they received to be in line with what the Controller of Budget has reported. Let's first be clear that, because that was the first thing we would ask. Have you received this money? Or we would ask them, what have you received from the national government? And they would tell us that that is the amount that they have received. As to whether they have spent it or not was our next question. And most of them did report that the money came towards the end of the financial year and therefore could not be absorbed, but they were able to provide budgets of what they intend to do with the money. A question which now will later be picked up by the Auditor General as to whether those monies have been utilized as they were budgeted for. Let's be clear about that. I would not want to be told I am making a case for the governors, but that is how things are. As to whether we are politicizing this issue, I don't know. I don't know how every other individual politician will speak on this issue, but the few times I have spoken about it, Trevor, I have spoken what is. I have spoken things as they are. I've spoken as things are unfolding, right? Like right now, as things are unfolding is what we are reporting right now, Trevor.
Senator, what is the most perplexing thing you found out in the counties that you've toured? Because at this particular point, you're the eye of Kenyans who are all looking up to you to unearth the scandals that are going on there. In the counties that you've toured, what is the most perplexing thing you found out that is just outright graft or outright theft?
For the 3 counties, I can't speak outrightly on graft. I haven't found it yet. What I have found are other issues which, as Kenyans, we should still be concerned about, because COVID is still here with us. It's not about gone. And Kenyans should not be relaxing. But our frontline workers need a lot more attention. That's the one thing I can say that is needed. The national government also needs to give a lot more support. There's not enough support coming. Already we know that frontline workers were given some benefits for 3 months, but those benefits have not come again. And we are wondering what is going on. So both county governments and national governments need to do a lot more. But when it comes to actual graft, Trevor, I'll tell you without a doubt, we must first have the Auditor General's report, which gives us now to the coin. It gives us to the coin, where has this money gone and how has it been spent? But from a quick, one-day visit at a county, it's not possible for us as senators to actually pick out every receipt or everything. At most is a quick scan. If they say that they have this many centers, we just go and confirm on the ground and we see one center, where are the ICU beds? We see them, are they working? Yes, they are working. We will now wait for the Controller of Budget to present the receipts that these beds were actually purchased for Kilifi County or Mombasa or any other county. Like we had the issue in Isiolo County, if you may recall some times back. When we went to Isiolo County, actually that had been a statement raised by the senator of Isiolo County, Senator Dulo, because whistleblowers had mentioned that the governor had not quite purchased the ICU beds that he was reporting to have purchased. So when we went to the ground, we were still not quite able to 100% ascertain that those beds were actually purchased. And what we demanded of the governor is to present now the receipts so that we can see for sure that he has actually spent money on ICU beds. So we will need the help of the Controller of Budget, the Auditor General's report, for us to be enabled to say to Kenyans for sure there has been money lost in this county.
Okay. Governor Mutua, what do you think is the biggest impediment in the fight against graft in the counties?
Well, I think the biggest impediment in the fight against graft in the whole of this country is the procedures that are there and the bureaucracy that has been put in front of Kenyans. Everything has become very bureaucratic. Nothing is straightforward. The processes of procurement, the processes of payment are all tied in with bureaucracy. Things take forever. And within those systems, that is where graft thrives. You know, people think that just by increasing procedures, by increasing many steps, you're actually fighting graft. All you're doing is opening channels for people to be creative. That is the main challenge. But let me say this. We sit down as governors, and I'm speaking about some of us, myself and others, who look at finances that come to us as public finances of mothers who are selling boga, as fathers who are paying a small amount of money when they go to the shop that becomes VAT. That is public money. We look at it as sacred money that needs to be taken care of. What we are facing as governors all the time are the blanket accusation that there is massive corruption in counties. If you look at the allocation of monies that come to government, national county governments, out of the budget, we get the constitution says we get 15%. That means 85% of all monies remain in the national government. 18% is shared among 47 counties. That means 15% shared among 47 counties. It is a minuscule amount of money compared to what is left in the national government. But when you hear the stories talking about graft, everything seems to be concentrating on the counties as if the country is coming to a screeching halt because 100% of the monies in the country are being supposedly eaten in the counties. And so what is happening is the counties have become a cover-up. So when you're attacking the counties, when you're attacking devolution, it allows you room now to do your wishy-washy things in the bigger areas. And that is what we are seeing now with the corruption that we're seeing ahead. I am not excusing graft at any stage. Graft in the county government, graft in the national government is still graft. We need to deal with it. But we are starting to, we are getting fed up, if I can use that as governors, to see everyday accusations and concentration on counties. Every small money is said to be stolen. So that is why I'm saying that as governors, and I think more governors need to be very open. I'm open. I would like to, Senator Kasanga, the Auditor General, come to Machakos, ask us for our receipts, our books, our beds. We'll show them to you. We have nothing to hide. But do not say we received money that we did not receive. If you've given an accounting, please get all the accounting documents before you release any data, because that's another big problem, whereby we are able to give the data to the Auditor General, we're able to give the data to the Control of Budget, and they go ahead and publish documents ignoring the data that we've given them, so that we look bad. I don't know whether it's they do it because they want to do it, or they do it because it's accidental, or it's a form of inefficiency. But we face that all the time as governors.
So do you think the Control of Budget is cooking these figures then?
I don't think they're cooking these figures, but there's a sense of inefficiency when it comes to reporting about the county governments. And we've had our own challenges with the Control of Budget. She knows, she's aware. We brought it up in the summit in terms of how long it's taking to process payments, how many questions were being asked that we never asked before. And the Control of Budget has a role to play, but she is not the Auditor General. So the auditing will be done. Her job is to make sure that the funds that are available or the funds that she's approving are actually available and for the intended purpose. But the documents that people are being asked for to account, the things that are being done, it's as if she's already auditing. And, people are responsible. If somebody has stolen, they'll be arrested, they'll go to jail. Okay. We want to get this country going on, not be stuck in bureaucracy, whereas millions of our young people are unemployed. The economy is at a standstill. There's no money in the economy. More bureaucracy just means the rich are getting richer, the poorer in this country are getting poorer.
All right. Senator, you're in Machakos now, but I see here Jerotich Sei on Twitter. She calls herself Active Citizen. She says, I think this Senate COVID-19 ad hoc committee should be sent to sanitize KEMSA immediately after they've finished washing in the counties. What will your recommendations be in your report, preliminarily? Because as you go around the counties, I'm sure you've already seen some trend.
That comment, a bit unfortunate, because I don't think we're in the business of sanitizing.
I'm sorry, it's not unfortunate, Madam Senator. Sorry to interrupt you.
Please,
that is an insult. That is an insult to you. That's an insult to the senators. It's an insult to the people of Kenya to assume that a whole committee of the Senate, by going and verifying the facts and the truth, and by you clearly saying that you have documents, but you're still going to call out for the Auditor General to verify that actually you are sanitizing. That is activism of the highest order that has no place in Kenya, and Jerotich Sei needs to apologize.
Governor, let Senator respond.
No, I take it very personal, because
this was directed to her.
That is the kind of loose talk in this country that is making our country and confusing our people. If people are doing their job, let them do their jobs. I'm not protecting them.
All right, Governor.
That is not helping at all in the debate.
Yes, let Senator respond. This was directed to her. Senator.
Yeah, I might have even lost my train of thought, but I would say to that citizen, they're entitled to their opinion, but it's very critical for us as Kenyans to understand how things are supposed to work. And as Kenyans, and I've said this to you, and Trevor, I said even this last time, it does not matter how many layers we have to put for accountability of public funds. We are a nation that is already plagued with so much corruption, you know. Even I know Governor Mutua, as you feel, I mean, you're really passionate and feeling really bad that the fact that fingers are always pointed at governors. But we have a right, Kenyans have a right to point those fingers, because we live in an era of so much corruption that right now Kenyans, what they need to know is the truth. So for the citizen who has just written, I've even forgotten your name, I'm so sorry, but you must understand there are those of us who are actually working. And we are working from the bottom of our hearts with a lot of genuineness. We are here to discover and to know what is the truth. And we are going to use the systems that are in place to help us, you know, because we are just one committee. And in fact, we were saying the other day that if county assemblies all had their small ad hoc committees as well, so that they can also help to look for accountability at the county level when it comes to issues of COVID, then it is in order. Let us have all those layers of accountability. Why not? This is public money. We have to get down to the bottom of how this money is going to be used. So for that citizen, I'm sorry you feel the way you're feeling, but we are going to use the systems that we have in this country, and we are going to get to the bottom of it. I have no problem with the Controller of Budgets report, by the way, as it is for the 3 counties. They were able to confirm that they received the monies that were reported in the Controller of Budget reports, and they were able to explain why they haven't absorbed all that money. Now we wait for the Auditor General's report to tell us exactly where has each coin and each cent gone to. Thank you.
Why weren't they unable to explain, Senator? Because you just mentioned that you've also come into issues of COVID-19 PPEs are not available. There's no allowances for the doctors. So why weren't they unable to explain why they haven't absorbed the money?
The money came late in the financial year. Trevor, if you understand what happens with counties, when the financial year is closing, it becomes impossible to expend at that point in time, because all those systems have to close down. Then you have to go to the county assembly and you have to pass a supplementary budget. Then you can start expending. But they did present budgets of what they intend to do. Remember, that is what the Controller of Budget does, is seek those budgets. So they were able to get that. And now for the next reports that will come, we'll be able to see how that money now has been utilized. Trevor, you know the way these things work. Kenyans really, really need to understand how the system works.
All right. Governor?
No, I agree with the Senator. And one of the things is that we have to stop politicizing everything and looking at everything as a cause of alarm. I know there's a lot of money that is lost in this country since independence. There are many systems of people stealing things, and we need accountability. But let the truth come out. You know, the thing that we have in this country that really troubles me, and one of the reasons I'm running for president, is because there is what you call lack of fairness. People feel like there's no fairness, that people are favored, that things watu wanaekelewa vitu, because it happens over and over again. We need to get to a country whereby if monies have been sent and you're told to account for them, you are able to account for them. If you're not accounting for them, then you are held liable. But we've seen circumstances whereby you are able to account for everything, but the report that comes at the end still says you did not account. Then when you go to present it again, they say, oh, it's okay, it's okay. But by that time, everybody in the country is looking at you as if you're a thief, as if you've made a mistake. The people who have stolen, people who cannot account, let them be held accountable. But if you can be able to account for the monies, if, for example, you say you gave us 285 million shillings, and you say that we see that you spent 150 million, can you account for the rest of the money? And we tell you, yes, that money that we did not spend is sitting in the bank. We've not yet procured for it. Then you should not go ahead and say this money cannot be accounted for. Whereas we've shown you, and you can check with the bank, that the money is sitting at the bank. When you say the money cannot be accounted for, it looks like we have stolen the money, that you looked around and the money has vanished into thin air, because that is what happens. They say the funds cannot be accounted for, whereas those monies are sitting at Central Bank of Kenya in our account, and we've shown you the monies are there. But when you say they cannot be accounted for because we only have receipts of what we've spent, then you're sending the wrong message. That is not being fair. However, if those monies are missing, they are not in the central bank, and you don't have the receipts, then you can say the monies cannot be accounted for. Then let's play it fair.
All right. Let's bring up some questions from the viewers who are listening in. The first one.
You promised Kenyans during the launch of your presidential bid that within a span of 3 years, you are going to create about 5 million jobs. Well, you've been the pioneer governor of Machakos County. How many jobs have you created within the last 7 years?
Governor, that's directed to you.
Well, thank you very much, and I'm glad that you're able to watch that and see that I have a plan using SMEs and others to create jobs. We've been able to create close to 350,000 jobs in Machakos. I've brought in over 300 new factories, both international and locals, that have started in Machakos. I've expanded the small and medium enterprise. I have brought in people who've come in and invested in areas such as tourism, sports, and others, and there's been an expansion. And this has been, to me, a test, like a playing ground for me, a pilot of what I can be able to do in Kenya. Remember, jobs are not created by government employing people. It's by expanding the economic base, by expanding the businesses, especially the small and medium enterprises, which are the key employers all over the world. Those are the ones that are able to absorb people, create a good environment, eliminate bureaucracy, and then you're able to create jobs.
Okay. Let's bring up another question.
He said that he would create 5 million jobs for the people of this country. Why can't he just advise the president of the day how to create those 5 million jobs right now? Do the people have to suffer and wait for 2 years?
Governor, that's to you again.
It's a very, the chief advisor of the president is the deputy president. So I don't want to start doing someone else's job. But nonetheless, is the work that I want to do. When I look at economic, and that's a very good question, when I look at the economic principles that we have in this country, when I look at the principles of Mwai Kibaki and what he did, and even what Uhuru did when he was with the stimulus packages and others, I have seen that there's been a gap in these last 7 years in implementation of what we agreed to do for the small and medium enterprises, because that's where the jobs are. We've got many documents, we've got money sitting in the central bank that have not been utilized. I have spoken about this. We also need to be creative. We need to stop this rural to urban migration. My plan is to utilize 250 billion shillings per year for 2 years to implement and set up business parks and factories in every sub-county. These ones will now become centers of economic growth. We start manufacturing. We don't have to send people to the cities, or we don't have to import things from China. We can now become exporters to Tanzania, to Uganda, to Zambia, to Egypt and other places. So these are things that are workable, have been done in other countries, and we had started doing them during the era of Mwai Kibaki.
Okay. Senator Kasanga, there's a question here from Collins Orono, who says the Senate committee is focusing on the 5 billion shillings county money and less than 10 billion in KEMSA. Ask Senator Kasanga, what are they doing about over $100 billion donor funds that Kenya received, and we have heard nothing about it?
It's not that we are not doing anything about KEMSA. Actually, the inquiry on KEMSA is ongoing as we speak. It's ongoing both at National Assembly and at Senate as well. At Senate, we had our first oral hearing about a week and a half ago, where we demanded for a lot of documents, and that is coming to us. No, in fact, actually, they were presented on Thursday last week, and we will have another hearing. I think later this week it will be confirmed by the clerk of the Senate when that hearing is going to happen. So we have not stopped looking for those COVID billions. We are still looking for them, and we are hell-bent on finding them. That one I can assure you. And when it comes to the Council of Governors, we had actually requested now as committee to hear from the Council of Governors when it comes to these items from KEMSA. And I'm aware, and it was confirmed in the 3 counties, that indeed there was a compilation that was going around all counties of all the goods and the equipment and whatever materials, donations, otherwise that came from KEMSA to the counties. We are going to get a tally of all that from the Council of Governors. I know that has been going on. In fact, I did read it even somewhere on social media, but it's going to be tabled before our committee later this week. So we have not stopped looking for the COVID billions that are lost or supposedly lost in the KEMSA, in this KEMSA conversation.
Okay. Senator, there's still another question here for you from Bernard Kiprop. He says, why do the senators have to go to the counties to get the accurate reports? Is there something off with our reporting system? Does that affect other accounting and reporting as well?
Our fact-finding mission as the COVID ad hoc committee is not just on money issues. We also want to see how the entire response team has worked. We want to see how the community outreach has also worked. We understand as a committee, we understand deeply as a committee, for us to overcome and be able to manage COVID-19, the community has to come into play. So some of our questions have to do with how is the community outreach? And you know, the national government response team did roll out the Nyumba Kumi initiative. In fact, they reactivated the Nyumba Kumi initiative because in every county, the county response committee is chaired by the governor and the county commissioner. And the idea of that is so that they can align both those levels down to the village. And the idea of that is that the community level needs to be activated completely. In fact, some of the things that were said here yesterday by the AMREF CEO, I was listening very keenly, and because he said categorically for us to manage COVID-19, we need to activate the community itself, the community leaders, the religious leaders, all need to come together so that when we see these crowds that are happening, which is a bit irresponsible of our leaders to get crowds, the way the crowds are now gathering for politics and things like that, I think is a bit unfortunate. But citizens need to now be activated from the ground upwards so that they can realize we still need to be consistent right now. We are still not out of the woods. Okay.
Governor, I heard you agreeing with Bernard Kiprop's conversation. You don't think the senators should come to the counties to check?
No, I think they should come to the counties. And I think, as the senator says, we need different layers of accountability. Accountability on what is happening in the counties and accountability of the reports about counties that are getting to the national government and getting splashed in the media. I think it is important for the truth to be told. For example, a document can come and say that ICU beds are there. It's also very important for somebody to go and actually find out that that's an actual ICU bed, because you can go and find an ICU bed here today. You come tomorrow, it's the same bed that has been moved to somewhere else. It's good for that verification exercise to ensure that the ICU beds are there. The PPAs have been delivered. You actually see them. That is important because that's their job. And that is because Kenya as it is, and I'm just saying because I know Kenya as it is, people can actually say this was delivered, but when you get to the ground, that does not exist. So I support the trips by the senators, but I want to say that I wish we had more groups.
Yeah.
I wish we had more groups, more organizations, international and local, coming for verification exercises in counties.
Okay.
Because, for example, come to Machakos, because when I hear of the propaganda about Machakos out there, negative propaganda, and when you come to Machakos, you find it's very different. For example, we had talks, people saying, oh, the ambulances in Machakos don't work, they are non-existent, this is just a story. When people come to the ground, they go to all the locations, they talk to a 90, they find the ambulances there, and they can come at their own time. They don't need even to tell me that they're coming.
Okay.
Don't alert the governor. If we say that we've dug boreholes, over 500 boreholes with solar panels, don't alert me. Get into your car, get into a helicopter, come and go around Machakos and verify for yourself without even involving the governor. Let's get the truth to come out, because there's a lot of propaganda out there, both from all sides, and Kenyans need to know the truth. And I welcome verification myself because I'm comfortable with what we are doing.
All right. Senator, you do understand the frustration of Kenyans, right? When the control of budget says one thing, the Senate ad hoc committee says a completely different thing. Who are they supposed to believe?
Trevor, we did not say a different thing. We've not said anything different whatsoever, other than the fact that Mombasa County did mention that they submitted their report to the Control of Budget Office in Mombasa, but somehow it didn't reach the final report. We have not disagreed on anything else. If anything, I have confirmed to you, Trevor, I have confirmed very clearly to you that the counties we visited confirmed the figures that the Controller of Budget reported that they have received. That's important. That the two, those ones harmonized very well. We also were able to harmonize, like in Kwale County, we were able to harmonize the donations. For instance, the figures that were given by the Controller of Budget as donations received. We were able to confirm with Kwale County that indeed those are the donations that they received in terms of money and how they had expended it. So it was only the Ministry of Health money that came late, so they were not able to expend it at that time, but they were able to provide budgets that were consistent. In fact, like for Kwale, they were consistent with the Controller of Budget report. So we have not gone against the Controller of Budget at all.
Though the Controller of Budget says they didn't get the report to her, you say that they sent it, but they didn't receive it. Anyway, let's not get back and forth on that. Mbithe here is saying, did the ad hoc Senate committee see the bank statements that the money is still in the account, or are they waiting for more probe?
No, we are waiting for the Auditor General's report. You see, it's very important for Kenyans to understand that our mandate as ad hoc committee is much, much larger and expanded. We are looking at health issues, we are looking at economic issues, we are looking at social issues. So, we canvass quite a number of issues. But the question of money, of course, we did raise it based on the Controller of Budget report. There is absolutely not enough time to start looking into bank accounts, and that's where the Auditor General now comes in. Trevor, it's important Kenyans understand the role of the Auditor General, who will finally give us the full picture of how money has come in and how it has been spent. Trevor, that is so critical that Kenyans should understand that. And if I was to report to you our findings as a committee as a whole, Trevor, would even probably take an hour, because there are good things that we discovered in the counties of Kwale and the county of Mombasa and Kilifi as well. We also saw what they were able to do with the little resources they were able to raise with their stakeholders. We also saw cooperation of stakeholders and county governments at a time of such confusion. They were able to come together and put strategies in place. In Kwale County, Trevor, we were able to see how the county government supported the Lunga Lunga border post. We actually made a point of reaching that border post so that we can see the effects of COVID on the border post and how the personnel there, who are national government personnel, how they're handling. And we were happy to see that the county government of Kwale supported them in cooperation with the national government. Those are good things, Trevor, which we cannot just, not mention them. It will be responsible of us not to say that these governments went a step beyond our expectation, actually. Let me just say and be sincere about it. And when it comes to the issue of money, the Auditor General will finally give us the true picture of how these monies were spent. Okay.
We're running out of time here, but there are a few more questions I need to bring up. Bring up another question.
My question for the governor is, that money that has been used, has it been properly utilized and are the results actually visible? And that fraction of the money that cannot be accounted for, what is the county government planning to do with it, if at all it has not been used?
Two things is that we don't have any money that is not accounted for. I think that needs to be very clear. The second thing is that, yes, the monies that have been used for the purchase of beds for isolation wards. Those ones, anybody can go and count them themselves. They have been used for the purchase of PPEs. They have been used for putting up ICU beds and also setting up ICU centers. expansion of isolation walls that are actually ongoing as we speak. So for me, from my part, I can say that my monies have been used, or the monies that came to Machakos have been used for the intended purposes. And we've been very careful because we've been scared that if we don't get our things done properly, this COVID pandemic will overrun us. So we've taken this opportunity to expand our wards, to improve our services.
Yeah.
We've spent the 97 million that we got to actually give the allowances to our health workers. And remember, I was the first person in this country to say that our frontline health workers need to be commended with a cash reward, be given allowances, so that because they are the frontline. And so we were one of the first counties to actually use our own monies to pay and give them to our health workers to motivate them in these very difficult conditions.
All right, let's bring up our final question.
Nauliza, kwa nini aliajiri watu wengine under contract ya UHC na wale walikuwa hapo mbeleni wakaachishwa kazi na hakuna nafasi wamepewa katika ASCO?
I don't know whether you got that, Governor, or should we replay it again?
No, I got it. I think he's asking about the employment of universal healthcare workers.
Yeah.
Machakos has been one of the biggest beneficiaries of the UHC pilot, but we've gone a step further in Machakos. In Machakos, it doesn't matter what you are ailing from. Under UHC, you are treated for free in all government institutions that we've also upgraded to very high standards. So we got a portion of the UHC program under the national government was to hire UHC health workers who are helping us through that mode. We have our own health workers. Machakos has a very expanded health worker population because I invested heavily. That is why we've been able to have a Machakos Cancer Center where we are treating everybody for free from pathology. Even if your bill is 50 million, it's free of charge. Surgery is free of charge. Everything is free of charge in Machakos for healthcare because healthcare is a right, according to me. It's not a privilege. So unfortunately, when the UHC program ended from the national government, the funding, the employment money for the expanded workers that were employed for us by the national government expired. And so we are not able to pay for them.
Okay.
Sorry, I think I lost here. So we're not able to pay for them. So we are hoping and we are crossing our fingers that President Uhuru Kenyatta rolls out the universal health care so that we can retain these very good health workers that have been working in Machakos and elsewhere in the country.
All right. Because of time, I'll give you a chance for closing remarks, each starting from Senator Kasanga. When should Kenyans expect your final report? What will be your strongest recommendations going forward, having seen what you've seen in the counties?
Trevor, our final report may be determined by when we shall receive the final Auditor General's report when it comes to the use of COVID funds, because ultimately, in the end, we must be able to report on that as a committee, Trevor. Most of our recommendations, of course, will have to go in line with the way forward for counties, considering we have a situation that is still unfolding as a globe. And in some countries internationally, we're already seeing a second wave of infections. And this is our fear. Are our county governments ready enough to handle? And when you hear the doctors now reporting that, let us not celebrate yet. And the sort of curvature that you're seeing in Nairobi and maybe Mombasa, which is suggesting maybe a drop in the infection rate, does not necessarily mean that that applies in the country throughout. You might find actually now other counties, it's the time now it is rising. So our mandate as a committee is to check how well are our counties, prepared to handle COVID now and as it continues to unfold into the future. And of course, we have to add the issues of not just health, but economics as well. The financial issues, how Kenyans have been affected by their loss of livelihoods is a major issue. So part of our reports are also looking into how county governments are looking at propping Kenyans who have lost their livelihoods, as well as how are they looking at jump-starting the economies of the counties as we go forward. Again, we've been looking at human rights issues and social issues. So for the very, very vulnerable homes, how are the county governments supporting them? What programs are they putting in place, not just for now, but also for posterity? So there's a silver lining, which we must say is coming with COVID, because it's forcing these county governments to think beyond and think outside the box on how to remain, to sustain their citizens throughout this period and going forward, Trevor.
Okay.
So maybe just as a parting shot to Kenyans, it is not time to relax. It is now even time now to be more watchful. And yes, we are living in a time of our country where there's a lot of corruption. So we need to open our eyes and our ears more. We have to learn to sift the truth from the noise, the truth from the noise. And in the end, we want to see prosecutions on people who have misappropriated public money.
Okay.
Thank you.
Governor, final remarks, very briefly.
I just want to say that I congratulate the Senate committee. Kenya has many issues, and I can see the skepticism that's in a lot of people. Yesterday, when I declared that I'm running for president 2022, I said that computer Kenya imehang, that Kenya needs a reset. We need a reboot. Okay. Where it is now, the system, the processor has problems, and we need to be able to have systems that actually work for our people. So all this skepticism and everything that is going on is because we live in an environment where people have been seeing graft and people get away with graft. They have seen monies being spent, and only a few are arrested, others are let go. So we need a country that is fair. Let us also be watchful that COVID-19 does not take us by surprise. Yes, things are getting better, but this is the time when they're getting better. It's giving us a small window of opportunity to improve our services, ensure we've got more beds, more ventilators and everything, and be ready just for the worst case scenario.
All right,
lakini tujue ya kwamba mambo yatakuwa fresh katika nchi yetu if we work together as Kenyans.
Governor, there's one quick question here for you. They were saying that please ask the governor about the Mala-Kasaveni road, which is totally impassable, and where residents are forced to collect monies to maintain the said road since all their pleas have fallen into deaf ears, and other roads around Machakos County. That's from Stephen in Machakos.
I want to say that there are about 100,000 kilometers of roads in this country, from the north of Mandera to the south. The government that we have right now, including county governments, does not have enough resources to fix and repair every road. That is why we are asking as counties, we get a higher allocation than the 15% to 45%, because that will allow me to have more resources to share with healthcare, to share with water, to share with food security, and be able to correct and build the roads of some of my people, like the ones in Mala, who are living in places where the roads are bad. I wish I had the money, then I'll be able to build all the good roads, because as you know, I'm known for Mandeleo and Mandeleo Chap Chap. So this is a struggle that we are facing in this country. When you hear about us getting debt, and some of that debt is stolen, these are the challenges we are facing. We need a country that grows economically, where we get more money, we get better foreign exchange, better balances, then we have more money to do work and repair roads such as the ones of my people that they're talking about. That is the situation everywhere in the county.
On this one, he was very specific on the Mala-Kasaveni road. So is there a plan to fix that one, even though there's not enough resources?
We have plans to fix many roads. That is just one of about 40,000 kilometers of roads in Machakos, new and old roads that we are trying to fix. So we are trying as much as we can, and I hope that we'll be able to get to that road as we get to others. That's why we are asking as county governments for 45% allocation of more money. So the money doesn't just stay in the national government, so we can utilize it for our people on the ground, because devolution does work.
All right. Thank you so much for speaking to me this evening. Governor Dr. Alfred Mutua, Machakos Governor Santi San, and Senator Sylvia Kasanga, the chairperson, Senate COVID-19 Ad Hoc Committee. We'll find out what the report is when it is actually filed. All right, and thank you so much for tuning into the Monday Report. That is why we call it a night. On behalf of the entire team that made this possible, plus your feedback, we appreciate that. My name is Trevor Ombija. Have a good night.